Hello, I'm Dr. Pramod Bhor, a joint replacement surgeon and director of orthopedics at Fortis Hospital Vashi. Today, we are going to speak about a few myths about joint replacement surgery. So, the commonest myth is that we will not be able to bend a knee joint after doing a knee replacement. No, we are able to gain complete movement after doing a knee replacement. We are doing a knee replacement to have a completely painless mobile joint. So that is an important thing to remember. We are again giving a mobile joint. So you are able to bend your knee. So second myth is that it cannot be done in younger patients. So it is not the case. If it is indicated, it can be done for younger patients. If need, my youngest patient is of a 36-year-old male who had a post-traumatic knee after an injury. He was not able to bend and it was a very painful knee. So I have done a replacement in a younger 36-year-old male patient as well. One of the commonest myths is that we are putting metallic implants and metal will cause reaction in the joint. No, the metals have been tested very nicely. They have been tested for many years, and they are inert metals, cobalt chrome or titanium niobium nitride, which are supposed to stay inside the body and they do not cause any reaction. Even patient having metal reaction, who having metal allergies, so these kind of patients, in these patients we use titanium niobium nitride implants. So for these patients also there are hypoallergic implants that are available. One of the commonest thing is that we require physiotherapy for lifelong if once we have done a knee replacement. No, you do not need physiotherapy for lifelong. Physiotherapy is needed only for a few days after surgery. Once you are able to exercise and strengthen your joint, you do not need physiotherapy. The exercises have to be done on your own by the patient himself. Few patients ask me that I have diabetes, I have blood pressure, can I operate? In patients of diabetes, I should not operate. No, that is not the case. 90% of the patient, that is an elderly age group, 95% have diabetes, have blood pressure, have some amount of cardiac complications. So all these patients, we normally take care of the diabetes. We optimize the patient in such a way that he or she is able to undergo the surgery, and there is no problem after the surgery. So 95% of patients have diabetes or hypertension, whatever comorbidities that we have. Now coming from diabetes, hypertension and younger patients, I am too old for surgery. That is one of the things. So again, coming from the spectrum of 36-year-old, my oldest patient who has undergone a knee replacement with me is a 93-year-old male patient. There is no age. If a patient is active, the patient wants to walk, and it is properly indicated, we definitely can go ahead and do operate. So we just have to confirm that the patient is active and the surgery is really going to help them. So that way every patient can be operated and there is not a problem for that. So one of the commonest thing is that many patients ask me that there is a high risk of failure. So many patients have said कि नहीं knee replacement करेंगे तो fail हो जाएगा, कुछ फायदा नहीं, मैं जगह पे बैठ जाऊँगा. So no, it is one of the most successful surgeries. It doesn't only go by saying that by my saying, it has been proved over the years. Number of knee replacements have increased over years, and that is what is the biggest proof that knee replacement is successful. Many of the patients say that they cannot drive, they cannot move around after surgery. You are able to do each and everything. You can climb up and down the steps, you can go for a small trek, you can walk on uneven surfaces, you can definitely drive. So we are doing a replacement for making you go back to your normal regular life. Few restrictions are there, like squatting and sitting cross-legged, but you have that much amount of movement, you have complete movement. Squatting and sitting cross-legged has to be avoided, and it is not that you cannot do it. So that is one most important thing that we should understand. One commonest thing that people have query that the surgery only lasts for 5 to 10 years. No, it is not that way. The implants which we are using nowadays, they have a longer life, 20 years, 15 years, 20 years, and depending upon your exercises, bone strength and everything, they can last you long. So once the surgery is done after 50, 55, 60 years, definitely you would never require a replacement surgery, a revision surgery. So it is very important to remember that you do not require a revision surgery after that. Most common apprehension, I would say, not a myth, is that after a surgery it is very painful in the immediate post-operative period. So yes, it is a bit painful after a post-operative period, because any surgery it is going to pain a bit, but we are taking care that the post-operative period you are being given analgesics and exercises that reduces the pain further, but that slowly and steadily reduces, and the patient can go home in 3 to 4 days. So the medicines can stop your pain or reduce your pain in the post-operative period. It is that manageable, easily manageable. So these are a few myths that we have to understand. Thank you for listening to me. Thank you.